Hello everyone, I am Dr. Ekta Bhushan, teaching anatomy and physiology of exercise at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic causes, treatment and preventions of sports injuries. So, sports injuries are common and can occur throughout your body to bones, muscles, tendons, ligaments and other structures. You can treat many minor injuries at home with rest, ice, compression, elevation and over-the-counter pain medications. But some injuries require medical treatment such as immobilization, physical therapy and surgeries. So let's start. What are the causes of sports injuries? So accidents such as a fall, bad habits with exercise such as not warming up or stretching enough, lack of safety equipments or gear that's damaged or worn incorrectly, shoes that don't fit well or provide enough support, sudden start to an exercise program or a significant increase in physical activity that your body is not used to. Now, what we will discuss the symptoms of sports injuries. So, aches, pain or tenderness, bruising, deformity such as bone or joint looking out of place, decreased range of motion, grinding, cracking, clicking or popping noises, inability to bear weight on your hip, leg or foot, skin that's warm to the touch, stiffness or weakness, swelling, trouble moving a body part normally. For example, you can't move it as far or it looks up when you try to move, locks up. Now we'll discuss the diagnosis. So many sports injuries cause immediate pain or discomfort. Others like overuse injuries might be noticed only after long-term damage. These injuries are often diagnosed during routine physical examination or checkups. If you think you have a sports injury, your doctor will likely use the following step to get a diagnosis. These includes, first is the physical examination. Your doctor may attempt to move the injured joint or body part. This helps them see how the area is moving or how it's not moving if that's the case. Then medical history. This involves asking you questions about how you were injured, what you were doing, what you have done since the injury and more. If this is your first time visiting this doctor, they may also ask for a more thorough medical history. Then imaging tests like X-ray, MRIs, CT scans and ultrasounds can all help your doctor and healthcare providers see inside your body. This helps them confirm a sports injury diagnosis. Now, we will discuss the sports injuries prevention, how we can prevent the sports injuries. So, the best way to prevent a sports injury is to warm up properly and stretch. Cold muscles are prone to overstretching and tear. Warm muscles are more flexible. They can absorb quick movements, bends and jerks, making injuries less likely. Also take these steps to avoid sports injury. So first steps will be use the proper technique. So learn the proper way to move during your sports or activity. Different types of exercise require different stances and postures. For example, in sports, bending your knee at the right time you can help avoid an injury to your spin or hip. Then have the proper equipment. So wear the right shoes, make sure you have the proper athletic protection. Then ill-fitting shoes or gear can increase your risk for injuries. Then don't overdo it. Don't overdo the exercises. If you do get hurt, make sure you are healed before you start the activity again. Don't try to work through the pain. When you return after letting your body recover, you may need to ease yourself back into the exercise or sport rather than jumping back in at the same intensity. Now, cool down. Remember to cool down after your activity. Usually, this involves doing the same stretching and exercise involved in the warm-up. Then resume activity slowly. Don't be tempted to nurse your injury for too long. Excessive rest may delay healing. Take things slowly and ease back into the exercise or your sports of choice. Then childhood. So who are at the risk? So the first is childhoods. So because of their active nature, children are especially at risk for sports injuries. Children often don't know their physical limits. That means they may push themselves to injury more easily than adults or teenagers. Then age is another factors. So the older you grow, the more likely you are to experience an injury. Age also increases the odds that you have sports injury that linger. New injuries may aggravate these previous injuries. The next factor is lack of care. Sometimes serious injuries start off as small ones. Many injuries that results from overuse, such as tendinitis and stress fractures, can be recognized early by a doctor. If they are left untreated or ignored, they can develop into a serious injury. Then the next factor is being overweight. So carrying around extra weight can put unnecessarily stress on your joint, including your hip, knee and ankle. The pressure is magnified with exercise or sport. This increases your risk for sports injury. Children or adults who plan to begin participating in sports can benefit by having a physical examination by a doctor first. So now, when should I seek medical attention for a sports injury? So even though many sports injuries can be treated at home, you should seek medical attention for pain that interferes with movement and doesn't get better over time. Massive swelling that doesn't slowly decreases. Extreme bruising or bleeding. Inability to use the injured area. Obvious deformity such as your leg bending in the wrong direction. Now we will discuss the treatment of injuries. So, the treatment is price. We have to protect the body, then rest, ice, compression, and elevation. Sometimes you can see this as a rice only, and sometimes you can see as a pricer also. So, R refers to rehabilitation. So, first of all is the protection. So, protect the affected area from further injury, for example, by using supports. The rest is avoid exercise and reduce your daily physical activity using crutches or walking stick may help if you can't put weight on your ankle or knee. A sling may help if you have injured shoulder. Then icing. Apply an ice pack to the affected area for at least 15 to 20 minutes every 2 to 3 hours. A bag of frozen peas or similar will work well. Wrap the ice pack in a towel so that it doesn't directly touch your skin and cause an ice burn. Then compression. Use elastic compression bandages during the day to limit swelling. Then elevation. Keeps the injured body part raised above the level of your heart whenever possible. It may also help reduce swelling. Now, pain relief. Painkillers such as paracetamol can be used to help ease the pain. Ibuprofen and other non-steroidal anti-inflammatory drugs, tablets or creams can also be used to ease pain and reduce any swelling. Aspirin should not be given to children under the 16 years age. The next one is immobilization. Immobilization can sometimes help prevent further damage by reducing movement. It can also reduce pain, muscle swelling and muscle spasm. For example, slings, splints and casts may be used to immobilize injured arm, shoulder, wrist or legs while you heal. If you have a sprain, prolonged immobilization is not usually necessary, and you should try gently moving the affected joint as soon as you are able to do so without experiencing significant pain. Then physiotherapy. Some people recovering from a long-term injury may benefit from physiotherapy also. So, it's a specialized treatment where techniques such as massages, manipulation and exercises are used to improve range of motion, strengthens the surrounding muscles and return the normal functions of the injured area. A physiotherapist can also develop an exercise program to help strengthen the affected body part and reduce the risk of the injury recurring. The next is corticosteroid injections. So, the corticosteroid injections may be recommended if you have severe or persistent inflammation. So, it can help relieve pain caused by your injury, although for some people the pain relief is minimal or only lasts for a short period of time. If necessary, a corticosteroid injection can be repeated, but you will usually only be able to have 2 or 3 injections a year. So, side effects can include thinning of the skin, loss of fat and infections. The doctors treating you will be able to explain the possible side effects in more details. Then surgery and procedures. Most sports injuries don't require surgeries, but very severe injuries such as badly broken bones may require corrective treatments. So this may include a manipulation or surgery to fix the bones with wires, plates, screws or rods. In some cases, it may be possible to realign displaced bones without needing an operation. Certain other injuries may also occasionally require surgeries. For example, an operation may be needed to repair a torn knee ligament. Now, recovering from an injury. So, depending on the type of injury you have, it can take a few weeks to a few months or more to make a full recovery. You should not return to the previous level of activity until you have fully recovered. But you should aim to gently start moving the injured body part as soon as possible. Gentle exercises should help to improve the area's range of movement. A movement becomes easier and the pain decreases. Stretching and strengthening exercises can be introduced. Make sure you don't try to do too much too quickly because this can delay recovery. Start by doing frequent repetitions of a few simple exercises before gradually increasing the amount you do. In some cases, the help of a professional such as physiotherapists or sports injury specialists may be beneficial. They can design a suitable recovery program and advise you about the exercise you should do and the number of repetitions. Now we have come to the conclusion. So some injuries obviously need medical attention. Severe bleeding, obvious deformity in the bone or joint, or significant swelling and pain are sign of serious problems. Even injuries that feels like muscle pull, strains and sprains can turn out to be breaks, fractures or tendon tears. That's why it's best to get a diagnosis from the healthcare provider. For minor injuries, your healthcare providers will likely recommended RICE. RICE stands for rest, ice, compression and elevation. We have added two more alphabets in it. In the RICE, the P that called as price, P for precautions or prevention, then pricer and R stand for rehabilitations. So doing these things can help limit pain and swellings after an injury. RICE also helps an injury heal faster. Use RICE for sprain, strain and severe bruises or bumps. So I hope you understand the causes, treatments, preventions of sports injuries in this chapter. That's all for today. See you next time. Thank you.